Hi, I'm Dr. Kurt Wohler. In some previous videos in this series, I've talked about what mitochondria are, how you test for mitochondrial dysfunction, what are some factors that can lead to mitochondrial problems. Let's talk a little bit about what are some things that can be done if there is an underlying mitochondrial issue. Well, based on the things that are identified through testing, organic acid testing, and then potentially mold or chemical or heavy metal testing, that's really the first step of intervention, right? Is trying to eliminate those factors, eliminate those toxins. But even with that, right, there's always different therapies that come up depending on what the toxic exposure is that will be helpful. But in the interim, we can still do things to support mitochondrial activity. And this holds true for us as adults as well as for kids and autistic kids. And that is as healthy a diet as possible, as diverse a diet as possible. Removing toxic food from our diet can have a major impact because as we remove inflammatory and toxic food, we're getting rid of a toxic stress and source that could negatively impact our cell function. And by doing that, we also start to incorporate more healthy food, more plant-based food, trying to move as best as possible to organic food to get away from pesticides, for example. So that's really, really important. Exercise has a big role in mitochondrial health. So even kids can exercise, and sometimes that might be just going for a walk, having them ride the bicycle, going to the park, playing on a play gym, being active. Because one of the things that exercise does is it helps to improve what's called biogenesis. This is the reformation of healthier mitochondria. It also has a role in what's called autophagy, which is the ability of a cell to get rid of old debris, old mitochondria, and other cellular stuff. Certain supplements play a role, and I think a lot of times just using a multivitamin, mineral, multi-mineral antioxidants, essential fatty acids is extremely helpful because it helps to fill in those gaps nutritionally that may be lost. And I understand having kids can be a challenge. They're not always the most willing participants in trying to eat a healthy diet. Certain targeted nutrients, ubiquinol, what's also called CoQ10, is important. L-carnitine, another nutrient that helps to transport fat into the cells, can be helpful. Certain antioxidants like vitamin C and lipoic acid, nutrients like selenium, for example, and zinc. A lot of times you can pick these things up through a multivitamin. So again, it's a combination approach, but first it's understanding what they are, how they become damaged, what are tests that can help to identify the problem in the first place, what are some other tests that can help to identify potential things that negatively impact mitochondria, and then getting to work trying to remedy the situation with specific therapies and overall lifestyle changes. So again, mitochondria play a significant role in our health, in our children's health. And if you're a parent or caregiver with an autistic child, it plays a major, major role in autism and needs to be assessed in every single child. So you have a good starting point of knowing how compromised the mitochondria are and what are some additional steps that need to take place in order to improve their overall health. Again, I'm Dr. Kurt Wohler. Thanks so much.